On this Monday night, mega merger. The blockbuster deal between two telecom giants worth billions. The impact on consumers, on jobs, and why federal approval is not guaranteed. Reassurances and refusals about the Oxford AstraZeneca vaccine.
Our friends phoned us and said don't take it.
Plus, a BC city and COVID hotspot opens a rapid mass vaccination clinic. The tough bind of relying on COVID benefits.
I'm behind on all my bills.
Calls for a repayment amnesty. Plus, partying in the pandemic.
It's actually great to see the world functioning in some normalcy.
Spring break in America. Millions are on the move.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with a multi-billion-dollar deal that would merge two of the most powerful business families in Canada. Rogers Communications has agreed to buy its rival, Shaw Communications, and red flags are already being raised about what it could mean for consumers. The transaction is valued at $26 billion, including $6 billion in debt. Rogers and Shaw carved up Canada when it came to cable and internet service. Rogers operated in the east and Shaw in the west, but they have been fierce combatants in the wireless sector. Now, Rogers is promising to invest $2.5 billion to build 5G networks in Western Canada, plus $1 billion to give rural, remote, and Indigenous communities high-speed internet. It's also promising to create 3,000 jobs in Western Canada. Big money and big promises. None of it will happen unless the deal gets federal approval, and that will include explaining why less competition is good for consumers. Mike Drolet has our top story tonight.
For generations, Rogers in the east and Shaw in the west played in their own backyards, while the invisible fence between the two could soon come down if telecom regulators approve Rogers buying its western rival to build out its 5G network.
This is all digital and wireless. I mean, this is the future of the world, right?
Bell is the undisputed top telecom company in the country. Merging Shaw with Rogers levels the playing field while leaving consumers with one less cellular option. As part of the $26 billion deal, Rogers is offering up some promises, one of which is customers of Shaw's Freedom Mobile won't see a price hike for 3 years. But telecom experts agree the math adds up to one thing: higher prices.
This is a long game. It's nice to know that your costs may not be going up for at least a couple of years or 3 years, but we know that in the long term they will. And that absence of competition in many ways really guarantees the notion that costs will go up if this merger goes through.
Politically, that could create a problem for Prime Minister Justin Trudeau, who promised in the last election to reduce cellular bills by 25% over 2 years.
Everyone complains that they're paying too much for cell phone service.
Comparing 2 gigabyte plans shows Canadians are paying $74 on average, compared to $60 in the US, $25 in the UK, and $22 in Australia. As part of the deal, Rogers also promised to create 3,000 new jobs in the West, while maintaining a regional office in Calgary, where Shaw is based.
Maybe that'll continue and maybe it won't. The likelihood of the sophisticated job staying in Calgary, frankly, is low. It's going to shift. Over time, it'll shift east. It almost always does.
So if the prices go up and the promise of jobs doesn't pan out, will the benefits of an operational 5G network be enough? Will Mitchell of the Rotman School of Business says if you look at the bigger picture, it has to.
And imagine we don't have sophisticated 5G, and the US does, and China does, and Korea does, and the rest of the world does, and we're trying to compete on 4G or mediocre 5G. We lose.
The deal is subject to regulator approval and won't be finalized until sometime in 2022. Mike Drolet, Global News, Toronto.
There is lots to digest in this deal. To help us break it down more, Anne Gaviola, our new senior business correspondent, is with us. And welcome. Rogers and Shaw are framing this deal as a win-win for everyone. The press release says it will generate more choice and competition for businesses, as well as realizing the full benefits of next-generation networks for Canadians and Canada's productivity. How much of that, Anne, is hype and how much is true?
I would take that with a grain of salt. I mean, keep in mind that messaging is coming from the people trying to get this deal pushed through. Every analyst and industry expert that I've spoken with says no matter how you slice it, this looks like, basically based on the way that it's been presented, it's going to equal less competition and higher prices for consumers across Canada. And in addition to that, even though there is a lot being promised here for Western Canada in terms of new jobs, you do have to sort through some of that corporate speak. And buried in there is the fact that Rogers expects to realize annual cost savings of about $1 billion in the 2 years after this deal goes through, if that does happen. And a lot of people are saying, you know, that could come in the form of job cuts, maybe not necessarily in Western Canada, but in other parts of the country.
And this is not a done deal. It needs government approval. What's your read on that?
Right. It's going to be an uphill battle for sure. There are still a lot of stakeholders that need to sign off on this. If you take a look at what happened to Shaw Communications shares on the stock market today, it looks like investors do not believe that this deal as presented is expected to pass. They've been trading shares of Shaw Communications below the Rogers offer price. And in addition to that, there are several regulatory hurdles that this needs to jump over. So the CRTC is going to be scrutinizing this, as well as the Competition Bureau, the Ministry of Innovation, Science and Economic Development has to weigh in on all of this. And this would set an important precedent as well. It would effectively, decrease competition, which is the opposite of what federal policy has been trying to do here across Canada over the past decade.
All right, our senior business correspondent, Anne Gaviola in Toronto. Thanks. The Kielburgers were back in the spotlight today. Brothers Craig and Mark, founders of the We charity, were questioned under oath by the House of Commons Ethics Committee today, a process they describe as a political trial. Our Mike Couture was watching the hearing. Mike, what happened?
Well, Donna, it took a summons from the Ethics Committee, but the Kielburger brothers did answer questions for over 3 hours, and they came out swinging. With their lawyer by their side and a scathing opening statement, the co-founders of the We charity took swipes at politicians of all stripes, saying the committee was putting them on trial in the court of public opinion.
We didn't advise the Prime Minister and Mr. Bono not to recuse themselves. We never prorogued Parliament. We're not involved in the decision to filibuster the committee this fall. This is a political scandal for the government, not We charity.
But they say it's both the charity and the kids they help that have suffered as a result. The $543 million Canada Student Services Grant program was handed to We charity without the usual tendering process, but has since been cancelled. It's resulted in the Ethics Commissioner investigating both former Finance Minister Bill Morneau for his ties to the charity and Prime Minister Justin Trudeau, as a number of his family members have appeared at We charity events.
Have either of you been contacted by the RCMP?
Despite being asked several times, the Kielburger brothers say they're not being investigated by the RCMP, the Canada Revenue Agency, and the Internal Revenue Agency in the U.S., but they are cooperating with a number of other probes related to the Canada Student Services Grant. Now, some of those probes are looking at the access We charity had to the highest levels of government, despite not being registered to lobby.
He goes directly to the finance minister of a G7 country and calls him by his first name. That is lobbying. It's lobbying. They might think they're besties, but it's lobbying.
I will simply point out again that it is literally not legally possible for me as a volunteer to register.
Opposition MPs also brought up a thank you message Craig Kielburger sent to his senior staffer inside the Prime Minister's office, thanking him for his help in shaping the program. A message that Kielburger says was simply a form letter sent out by his executive assistant. Donna?
Mike Couture in Ottawa, thanks. Now to COVID-19 and concerns in Europe about the Oxford AstraZeneca vaccine. France, Germany, Italy and Spain have become the latest countries to pause their use of the AstraZeneca vaccine. There have been a small number of reports in Europe of people developing blood clots after being vaccinated. Several of the world's top medical agencies are reassuring people, saying there is no clear evidence the shots caused those blood clots. The European Medicines Agency says it is now reviewing the reports and it's urging countries to continue their rollouts. The AstraZeneca doses being used in Europe are from a different production facility than the doses being shipped to Canada. Prime Minister Trudeau today tried to reassure Canadians about getting the vaccine here, but as Mike Armstrong reports, some lingering doubt is setting in.
Touring a mass vaccination center in Montreal, the Prime Minister got personal for a moment. Crouching down to speak to a woman waiting for her shot, he shared that his mother was vaccinated last week. But one of the big messages on this day was again about supply. To reassure Canadians, the AstraZeneca vaccine is safe and works.
The best vaccine for you to take is the very first one that is offered to you.
That message is being repeated over and over by politicians and experts. The questions around AstraZeneca's vaccine don't apply to Canada's supply. Europe's using a different manufacturer, so they're completely different batches. That isn't getting through to everyone. This woman refused her shot Monday morning once she found out it would be AstraZeneca. The reason?
Our friends phoned us and said, don't take it.
Those doubts and gossip are having an impact. One local health board in Montreal reports 10% of people offered AstraZeneca over the weekend refused.
So most of our vaccination will happen here.
For many, the option they're hoping for is a pharmacy. As of next Monday, 350 Montreal pharmacies will be offering vaccinations for anyone 65 years and over. They're going to be giving the Moderna vaccine. The booking is only being done online, but spots are being scooped up quickly.
Since this morning, the phone's been ringing nonstop for appointments.
Now, Quebec's ramping up hasn't come without hurdles. Several spots in the province Monday had patients waiting for appointments outside in temperatures below minus 20 degrees Celsius. But the biggest challenge remains supply, hoping it keeps growing going forward. Mike Armstrong, Global News, Montreal.
The retired military general in charge of Ontario's vaccine rollout is leaving the job. Premier Doug Ford revealed today General Rick Hillier will finish at the end of the month.
I think I'm going to put a ball and a chain around his ankle to keep him. I tried to get him to renew it, but as he said, Doug, I did the job I came for, and we got everything set up, and now, as I agree with him.
Ontario, though, has faced intense criticism over its slow rollout and confusing messaging. Today, the province launched its vaccine booking system. People 80 and up are eligible to sign up, though there were early reports of some glitches with the system. Though Ontario's rollout is starting to pick up, so are highly contagious new variants, and that's led to a stark warning from the Ontario Hospital Association. It says Ontario is now in a third wave, and it says variant cases are rising steeply. It says strong adherence to public health measures is urgently needed to prevent overwhelming hospitals. The campaign to vaccinate an entire city within weeks. Coming up, why Prince Rupert is accelerating its mass immunization plan. BC is pushing ahead with its COVID-19 vaccination campaign. People aged 84 and up can now book appointments. In the northern city of Prince Rupert, adults of any age can get their shot. The region launched a sweeping vaccination campaign today. The goal is to get every adult immunized by April 1st. Global's Ahmad Agahi is there to explain how the city is doing it and why. Ahmad?
Well, this is an unprecedented vaccine rollout, and people in this community are excited to be taking part with the entire province and country watching. The first vaccination started at 9 a.m. sharp this morning at this civic center behind me that has been transformed into a vaccination clinic, and it is here where the entire adult population in the town of 12,000 will be immunized over the next 2.5 weeks.
Okay, 1, 2, 3.
And with that, 87-year-old Perry Boyle becomes the first eager participant of a community-wide immunization campaign, the likes of which we have not seen in Canada.
It's like anything else, even if you got a job somewhere, get there and get at her. And that's just what I did here this morning.
Health officials are targeting the small northwestern BC community with an accelerated approach, aiming to halt its surging COVID-19 infection rate.
We've done our best as a community, with very few exceptions, to follow all of Dr. Bonnie Henry's recommendations. But there's some really unique circumstances in Rupert.
The city is remote. Its hospital only has a few acute care beds, and 40% of the population here is Indigenous, citizens that are disproportionately affected by the virus in Canada. Then there's the devastation at the community's long-term care home, Acropolis Manor. where dozens, including understaffed workers, tested positive, and at least 14 residents died.
If there was any other community that had our geography, shared our unique risk factors and circumstances, we would wish them well. We would not accuse them of jumping the queue or being rewarded for bad behavior.
Mrs. Wainwright, we're being vaccinated.
For 86-year-old Martha Wainwright, there was no hesitation.
Having to go out shopping, maybe feel a little safer.
And while no one knows exactly what will happen after the health officials here finish their work, for the first time in more than a year, there is hope on the horizon.
Definitely people are feeling like they're going to be able to plan for a post-pandemic spring versus a late summer or fall that we'd all been anticipating.
The first week of this mass immunization campaign will target those between the age of 60 and 95, and then the goal is to have a shot in the arm of every adult in Prince Rupert by the end of the month. And from those that I've been speaking with who are involved in this vaccination effort, well, they're saying that if things go smoothly, they won't be surprised if this unprecedented campaign of vaccinations finishes well ahead of schedule. Donna.
Okay, Ahmad Agahi in Prince Rupert, thanks. Prime Minister Justin Trudeau made an official trip outside the nation's capital for the first time in months today. He was in Montreal, where he announced a major investment in a factory that makes batteries to power electric vehicles. Both the federal and Quebec governments will invest $50 million to build an assembly plant north of the city. Lion Electric, the company behind the project, will put up $85 million. The factory will create 135 jobs once it's complete. It's expected to be operational in 2023. Beijing's air apocalypse ahead, the wild weather smothering China's capital. This is what it looks like in Beijing. A massive sandstorm has shrouded China's capital in orange dust and smog. Residents have been told to wear masks and avoid outdoor activities. The city's air quality index reached its maximum level of 500, and hundreds of flights have been canceled because of visibility. Sandstorms are nothing new in Beijing. They blow in from desert regions near the city, but residents say they haven't seen one this bad in years. Almost a year ago, no one had ever heard of the Canada Emergency Response Benefit. The $2,000 monthly assistance program became a lifesaver for millions of Canadians out of work and out of pocket because of the pandemic. And since it evolved into the Canada Recovery Benefit, billions more have been paid out. Tonight, Abigail Beeman talks to those who have relied on it and who fear what comes next.
When live drag shows became impossible, Chris Reed, aka Continental Breakfast, moved online.
It was venues and nightclubs and theaters that closed first and will most likely be the last thing to come back. And I realized that all of a sudden it felt like my job had almost become illegal.
Virtual wasn't easy. This show was reported for being explicit and taken off social media. So Reed started their own production company, Queer Based Media. The money isn't nearly as good. Reed had to move and relied on first the Canada Emergency Response Benefit and now the Canada Recovery Benefit. Reed's now worried about whether they'll get a letter from the CRA saying they need to repay some.
It was constantly thinking that I was either making too much money or not enough money, and I'm behind on all my bills, you know?
The people who are already struggling before the pandemic numbered in the millions of Canadians.
Natalie Appleyard says the vulnerable are hardest hit by COVID-19. She's one of many advocates, along with the NDP, calling for a repayment amnesty.
Rather than try to squeeze money out of people that already are struggling to put food on the table, we believe that anyone below the low-income threshold should be exempt from having to repay the CERB, and that we could just consider this an investment.
I'm very, very afraid. I have no idea what I'm going to do.
Yvonne Spicer has relied on federal benefits for a year. Now she's stressed about having to pay back more than $3,000 in provincial disability benefits. She attends college and is a caregiver for her mother.
You don't get a lot to cover your expenses. It really makes you feel like if I wasn't living with my mom, I wouldn't have a roof over my head.
The federal government was not able to tell us by deadline how many people were told they need to repay benefits. The employment minister's office tells Global News they will be flexible and understanding, but the minister herself has said an amnesty is not on the table. Abigail Beeman, Global News, Ottawa.
Next, spring break in America, and millions are partying like there's no pandemic. Spring break in Canada is underway for many students in British Columbia, Nova Scotia, and Prince Edward Island, but it's not like there is much to do. Travel is still discouraged, and our airports are mostly empty. Across the border, though, millions of Americans packed their bags and are getting ready to party. As Jackson Prosco reports, the pandemic is still with us, but in parts of the U.S., you'd never know it.
Like a scene from the before times, the party is back on. In the sunny southern U.S., spring break hasn't taken a break, despite the pandemic.
Yeah, I just feel like it's time to move on with our lives and stuff and get back out there.
It was just a lot more relaxed down here. A lot less people wearing masks.
No surprise, big crowds are gathering in the states with the fewest restrictions. Disney's Florida theme parks are fully booked. Airlines have seen their busiest days in nearly a year. 1.3 million passengers per day passing through U.S. airports.
It's actually great to see the world functioning in some normalcy. I miss seeing people out enjoying themselves.
The Centers for Disease Control cautions the virus hasn't taken a vacation.
This is all in the context of still 50,000 cases per day.
They've asked people not to travel, warning case numbers could quickly surge again, erasing recent progress.
I'm pleading with you for the sake of our nation's health.
Spring break hotspots like Florida and Texas are where those more contagious variants are spreading faster than anywhere else in the U.S. That's the part that concerns epidemiologists.
So you have to worry about people getting infected with that, bringing it back home where maybe they don't have as much of an issue with it right now, and potentially creating an issue.
As the weather warms up and as lockdown fatigue sets in, caution is increasingly a tough sell.
I wouldn't say we're really concerned about it right now, to be honest. I feel like it's pretty much tamed right now.
And so for the first time in a long time, millions of Americans will carry on as though everything is back to normal, even when it's still so clearly not. Jackson Prosco, Global News, Washington.
And that's Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is a frozen Balm Beach in tiny Ontario. Yes, it's a real place on Georgian Bay. We'd love to see your Canada. Please email it to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.